Hello and welcome to another episode of your show, Medical Talk. I'm your host, Dr. Mohammed Al-Mahtab. And today, we're going to be talking about a very interesting topic, which is hair loss. I'm sure a lot of you will be concerned about that. Hair loss is a fairly common occurrence. While it's more prevalent in older adults, anyone could experience it, including children. It's normal to lose hair, since according to the American Academy of Dermatology, we can lose between 50 and 100 hairs per day. Hair loss is not usually anything to be worried about, but occasionally it can be a sign of a medical condition. Some types of hair loss are permanent, like male and female pattern baldness. This type of hair loss usually runs in the family. Other types of hair loss may be temporary. So, to know more about this important topic, we are glad to host د.حنين الرقم, a consultant dermatologist who will explain for us the causes behind hair loss, how to diagnose this problem, and lots of other information. But right after watching this report.
As people get older, their hair often starts losing volume and thickness. However, hair loss can also result from a health condition, nutrient deficiencies, stress, and other factors. Treatment can often help manage hair loss that occurs by boosting hair health, thickness, and strength. Hair that falls out due to a health condition often regrows in time, but it's important to be aware that most people lose from 50 to 100 hairs each day. As hair falls out, a new hair regrows from the same hair follicles. Sometimes, however, hair loss can happen at a faster rate. Some of the most common factors that contribute to additional hair loss include genetic or hereditary factors, which health experts call androgenetic alopecia areata, which is an autoimmune condition, cancer treatment and some other medicines, stress, childbirth, hormonal changes, possibly due to a thyroid condition or menopause, and nutritional deficiencies such as the lack of biotin, zinc, iron, or protein. Doctors can often diagnose the cause of thinning hair by looking at the patterns of the hair loss. They may ask a person about their current diet, other medical conditions, a family history of thinning hair, or medical conditions that can cause thinning hair, and may send a hair or scalp samples to a laboratory for further testing. Blood tests are also common to rule out an underlying condition. A number of home remedies may improve hair growth. Although not all of them have scientific backing, a person should consult a doctor before using a home remedy, including herbal remedies for hair loss, and also including healthy foods in the daily diet, especially foods that are rich in proteins, fats, and certain vitamins and minerals, which are important for their health hair.
Welcome back. We're honored to have with us in the studio Dr. حنين الرقم, a consultant dermatologist. Welcome to our program, doctor.
Thank you so much, Dr. Mohammed. I'm so happy to be your guest today, and I hope everyone would benefit from the information we're about to share.
I am very excited to have you with me because God knows we have so many questions about a very important topic, and I'm sure a lot of our viewers would like to know one of the main common questions. But before we go through that, I think it's essential to explain to our viewers the phase of hair growth and what are the signs that we need to be aware of that could basically tell me that I need to seek medical attention.
Yes. Actually, the hair growth, we describe it as a cycle because the phases of the growth alternate between the growing phase. And the growing phase can take up to years, for example, if the hair was the scalp hair. And then it goes to a resting phase, and then we have the shedding phase. And then it keeps cycling in these three phases. So usually people do have a natural or some amount of hair loss routinely and daily, but they do see the signs that should alarm them to see a doctor when, for example, first they wake up in the morning and see a lot of hair on their pillow, or they look to themselves in the mirror and suddenly they feel that the scalp became more visible. Or when they parted their hair, their part became wider. Or for example, if they took a shower and they felt that too many hair is falling in the shower, or they brushed their hair or pulled their hair and a big strand of hair came out. These are alerting signs that this is not normal, something is happening and I need to see the doctor.
Great. Now, so what are the main causes of losing hair?
Actually, there are a lot of causes. We broadly categorize them to pattern hair loss, familial hair loss, or sometimes we call it genetic hair loss, and other causes, the causes that are not genetic and don't run in the families. These can be simplified to stress-related, nutritional-related, or hormonal. For example, if you have diabetes or a thyroid problem, it usually affects the hair and you see hair loss. And sometimes we diagnose patients with diabetes after coming to seek medical attention because of hair loss.
Interesting. So that would be like an early sign.
It can be an early sign of high blood sugar.
Really? Okay. So you mentioned about stress. Now we all know that, you know, psychological status of mind of the patient could actually affect not just, you know, the hair. It could affect the entire body.
Yes.
In your opinion, does the psychological status of the patient could actually affect the hair loss situation?
Actually, the stress can be physical and can be emotional. By physical, we mean severe diseases that happens to the body. For example, last year and the year before when we had corona, many patients presented with hair loss during the infection or shortly after having the corona disease. So it's a major stress to their body that affected their hair and became visible with the hair fall. Other diseases can be in the hair itself, like infection to the scalp or alopecia areata. Other emotional causes of stress also are important. For example, if someone is going through a divorce or getting ready for exams, these psychological factors affect the hair cycle. What it does exactly is that it pushes, so we have like 100,000 hair follicles on our scalp. Usually 100 hairs fall every day, up to 150. When we have a stressful event in our life, it pushes more hair follicles to go from the growing phase into the shedding phase. So more hair is going into the shedding phase and we see it visibly, like the hair is suddenly become falling that in an amount that is much more than the expected. This is what stress does to us.
Exactly. So, and just to follow on that, do you think it's reversible, meaning that if the stress be relieved or the patient is feeling much better, the effect of the stress and hair loss could be reversed?
Actually, usually it is reversible once you recognize the stress and try to treat it,
Yeah.
what I say is healthy hair never grows on a body that is not healthy.
Exactly.
So you have to take care of your body. If the stress was due to a disease, you have to cure it. If the stress is based on a situation in your life, you have to solve it. Sometimes we do give treatment, even if it is stress related, because the hair shedding is so much and we want to stop or interrupt this cycle.
Yeah, the rate of hair loss is more than the
Exactly.
normal thing, so we need to
Exactly.
intervene without, pharmacologically to basically help the patient to slow the rate of hair loss.
Yes.
Okay, in your opinion, who is more prone to hair loss? Is it men or women, and why?
In the past, we used to think that men are more prone to hair fall, maybe because they complain more. But both are affected. The difference between males and females is the pattern of hair fall. If we're talking about genetic or androgenetic alopecia, in the males, the pattern of hair loss is mainly in the vertex of the scalp and temporal area, so it's very obvious. For the females, the most common pattern of hair loss is, we describe it as a Christmas tree because it goes back into the hair, but they preserve the hairline. So it is a bit less obvious than the male pattern hair fall. The second common presentation in the females is having a more visible scalp or a wider hairline. And the third type is the one that is similar to the males, or we call it the mare pattern hair loss or the diffuse hair loss.
Now, does it make any difference? Because a lot of, especially males, they have and females as well, they have the hairline receding, but
Yes.
everywhere else is fine. So do you think that's just another pattern, or is it?
Where it starts is just a pattern, because usually it progresses. And when the females, they have the hairline preserved, sometimes this delay them seeking the medical help and treating their problem, because what's obvious and what other people see is still there and still intact, so they don't feel alarmed and they don't feel the need for an immediate medical attention.
Exactly. Definitely, it's more challenging for women than men.
It
right?
is, and because the hair is the crown of beauty, and
Absolutely.
everyone really wants to keep a healthy, shiny, thick hair, whether it's a male or a female, because it's really matters in their life, and it shows that they're beautiful and they're still young and they're still healthy.
Absolutely. We're going to talk more about this. We're going to have to take a short break, but we'll be right back, so stay with us. Welcome back. We're still talking in the studio with Dr. حنين الرقم, a consultant dermatologist. Dr. حنين, before the break, we talked about the importance of early detection. Now, let's go into a specific diagnostic skills that we need to do for our patients. Now, I'm going to be talking from your end as a doctor. What are the diagnoses that you use or tools that you use to diagnose hair loss?
Hair loss is a very common problem. We see a lot of cases every day. The important thing is to take a proper history. We have to know when did it start, for how long it's been going in this patient's life, and what makes it worse. Is there other members in the family that have a similar problem? Any other family member with baldness, any other diseases specifically to the hair that runs in the family. And then comes the examination, where we actually physically look at the scalp to make sure that there are any abnormalities, there's no redness, there's no scales, there's no actual signs of infection in the scalp that would affect the hair fall. We do sometimes the hair pull test, where we hold a strand and we count the number of hairs that are pulled out to see if it's normal or more than the normal. And nowadays we have a new test that is computerized with a small camera where we can visualize the hair follicles. It gives us a fairly good diagnosis or an idea if this was a pattern hair loss or it's acute problem that can be solved with certain things. We do get the help of investigations. I like to run general investigations to my patients to check their thyroid, blood sugar, their hemoglobin level.
Exactly.
Many patients do have some deficiencies, whether it's vitamin D, whether it's vitamin B, and other nutritional factors.
Exactly. It's important to have the full picture.
Exactly.
And
even if we're trying to treat the baldness, if they have some deficiencies, it cannot be corrected or respond properly to treatment if there are more deficiencies in the blood or in the systemic.
Exactly. And as you mentioned earlier, it could be an early sign of a very serious condition like diabetes and other conditions.
Yes.
Now we all know that you are what you eat. That's as they say, and a healthy body is very important, not just for your hair, but for your entire organs.
Yes, true.
But in your opinion, does the food has something to do with the hair loss?
It has a lot of things to do with it.
Okay.
The nutrition and the blood, the actual picture of the blood affects the hair a lot. Number one is the protein, because our hair is made of protein. So we should have a very high protein diet. And in our culture, usually we have 3/4 of our meal in the form of carbohydrates and a very little or small protein portion. This should be reversed, especially as we grow older. We need more and more amounts of proteins in our diet, whether it's animal protein, plant protein, a good source of healthy protein. Number two comes the minerals or the iron, especially. We have to make sure that the patient doesn't have any anemias, and eating enough dark green vegetables or red meats or any good source of iron to keep his blood level in good shape. Then come the trace elements like the magnesium, the vitamin B, and other nutritions. If we are able to maintain a balanced diet that covers almost everything, we will not need to take any pills.
Exactly. The supplements, you mean?
Exactly, any supplements.
What are the most common supplements in the market right now?
Most common supplements, most of the new companies are coming up with pills that are mainly based on proteins because it's the main thing that we lack in our diet. Then comes the iron, and then we have collection of multivitamins stuck together.
What about the product, the biotin, basically?
Biotin is a form of vitamin B.
Okay.
It helps. It became very famous because it not only has a role in the hair fall, but the hair strength. It gives the hair its shiny and luster appearance, so people like it, and they enjoy the look of their hair after taking it. Even they can maintain taking it for a bit longer because it makes their hair look better.
Absolutely. Now, what are the latest treatment options available to treat this serious issue?
Well, if we are talking about androgenetic alopecia or the genetic hair fall, first of all, the ampoules or the topical applications, we encourage using them because they are easy, affordable, simple, and the patient can do it and take care of it at home without the need for frequent visits to the doctors. Minoxidil is the star product in this category. Usually we start with it and it really gives good results. Number two, in the tablets form, we have the finasteride. Of course, each of the topicals and the tablets have its good side and its side effects, and we balance it according to the patient and his medical history.
Before we let you go, is there anything that we can do to prevent hair loss?
As we said earlier, healthy hair grows on a healthy body. So what can we do is to take care of ourselves by taking care of our food, eating a balanced diet, healthy, nutritional diet, it helps that we keep healthy, we stock our fridge with healthy options. So whenever we're hungry and we open the fridge, there are many options that we can choose from before thinking of junk or fast food.
Exactly.
Another thing is that we have some time for ourselves and we don't let ourselves fall into the circle of stress.
Yes.
Stress is everywhere in our very fast society nowadays. So do something that you really like. For example, I like reading or talking to friends or sharing a cup of coffee every 2 weeks with one of my close friends. Something that makes you feel good and like make you happy.
Exactly.
Would really help.
Okay.
Drinking a lot of water is really very beneficial. Even if you don't like the taste of water, you can add fruits, add slices of cucumber. It would also help.
Exactly. So it's important to stay hydrated.
Yes.
Okay. Thank you so much for being with. I know we have lots of questions we didn't cover, but unfortunately we run out of time. We'll hope to see you again with us in the near future. Thank you for your valuable time. We're very honored to have you with us.
You're welcome. I'm so happy to be here today.
Thank you very much. Dear viewers, we will have a short break and we'll be right back.
PRP is a clinical treatment that can be used as a standalone treatment or a treatment that can be used along with hair transplant surgery. Who do we recommend this treatment for? Usually it is for patients that do not have bald spots, but rather that they do have the follicle or their hair roots already preserved and they are alive. So what does the PRP usually do? It actually rejuvenates the hair follicle in order to supply it with some hair growth factors, and ultimately it will regrow the hair and give it more of a strengthening component. So what do we usually do with PRP? We usually obtain a blood sample from the patient and we put it in a centrifuge. This centrifuge, what it does, it actually separates the plasma from the blood. And in that way, we can get all the enriched platelets re-injected again to the patient's scalp. That being done, there are very minimal side effects when it comes to PRP. Since we are obtaining the blood from the patient, there are almost zero side effects when it comes to rejection from the body or when it comes to diseases that can be commuted. Also, one of the many factors and the many benefits of PRP is actually what it does is strengthens the thinning hair. Also, it increases the diameter of the existing hair, and it is done in an outpatient procedure, meaning that there will be no cuts, there will be no surgery or incisions. It is a very fast and effective treatment, meaning that as soon as the whole process is done, the patient can immediately leave and resume their daily life activities. In addition to PRP, we are offering our patients some meso, which contains vitamins and very effective hormonal treatments that can actually fight hair loss. During this process, also it is done in the same way, but in a very painless procedure and in a very quick procedure also. What we usually recommend for our patients is to actually go through a panel to screen for why the patient is suffering from hair loss. Usually it can be done through blood tests or a simple eye test to define what could be the real reason. So in addition to injectables of what we're actually offering in the clinic, we can also recommend for the patient to look for oral prescription oral medication. Also, we have intramuscular treatments that can help also with hair loss. In addition to all of that, some very effective components that can be used directly on the scalp to help the hair regrowth. We do tell the patients to be patient with all these hair treatments because this can take time. It can take months to see really good progression when it comes to the regrowing of hair. But it is a very affordable now lately, and it is a very quick and safe procedure for it to be done for patients especially that are considering it instead of going to more invasive treatments such as hair transplant surgery. So hair loss is not only limited to one certain gender. It can affect females and males, and also sometimes children. Reasons can be hereditary, reasons can be to a specific medication. Sometimes with females it could be a hormonal imbalance problem that can actually make females more aware of that they are suffering from hair loss. So there are many reasons of why there is a sudden change in hair loss, or there is a sudden change of hair thinning. Age groups usually differ when it comes to the reason of why the patient is suffering from hair loss. If it's hereditary, sometimes we do see it in younger patients. Male hereditary hair loss reasons usually start at the age of 30 and onwards, and with these specific types of hair loss, usually there needs to be more investigation and more treatments that could be combining two of treatments, like for example, let's say injectables and oral prescribed medication. So it could be a combination of both to see really good results. My recommendation is whenever a patient is going through hair loss, I really very keen to tell them that you should investigate the reason as soon as possible, or as soon as you can notice that your hair is starting to lose its volume or it's thinning from the frontal area. Because as soon as you get promoted to find the solution for the hair loss, the sooner the better, and actually in terms of treatment and in terms of effectiveness in the results.
Welcome back. This is my favorite segment, which is the fitness segment. Now, we all know that staying physically active is the key to help your body to stay healthy. And that is why we always make sure to show you in our program a fitness segment to help you with your exercising routine. So let's watch it together.
Hello everybody, Coach Ali here. Today I'm going to be speaking about a very important topic that you all need to know: adjusting intensity during your workouts. Okay guys, I believe personally that anybody can get work done, anybody can lose weight, anybody can make progress. But when you understand the concept of adjusting intensity, it's going to make it a lot easier to get you through what you need to do, whether you being a novice, a beginner, an expert, or even a professional. Okay guys, let me take you through a couple of forms of how you can adjust intensity. Number one, breaking down movements. So there are very fundamental moves or exercises that you're going to find within almost every training regimen: the squat and the push-up. Not everybody has the capability of doing a proper, correct squat for reasons like injuries or weight or any type of constrictions, or the push-up. But when you break down the movement, you're still going to get the exact same muscles moving, targeted, and ensure longevity, and that you can still go through these movements. For example, let's go with the squat first. Now, instead of pushing the hips back, which is a classic squat, maintaining a neutral spine, getting down to a 90-degree angle, if that is not possible, you can always bring a chair and think about pushing your hips back and sitting down on that chair to decrease the range of motion. You're still getting the same muscles working. If that is even difficult, you can even make it a little bit easier by decreasing the range of motion and only going down a couple of feet or maybe 1 foot down. You're still gonna get the same benefit. The push-up. Now the push-up, because you're carrying the whole weight of your body on your chest, that is not always possible. What you can do is what? You can drop your knees to the floor and go through the exact same movement. What that will ensure is basically half of the weight of your body is not being used right now, which is going to make it easier to go through the movement. Number three, the jumping jack. So if you're in a class and you see everybody in the class, for example, doing one jumping jack every second, If you're new to this, you might feel, okay, this is kind of a hectic pace, I need to slow down. That is okay. If you do one jumping jack every 2 seconds, adding a pause in between the movement, that is still gonna give you the exact same benefit. Last but not least, guys, let me show you the last form of adjusting intensity, rest periods. Every certain program has some sort of rest periods included in them. If you manipulate these rest periods, it will give you enough energy to get back to prime condition for you to follow that program. For example, if you feel that everybody is finishing the workout, resting 10 seconds and getting back into the next set, and you can't really keep up, that is okay. That will gradually become better. But increase that rest period. Instead of 10 seconds, make it 30 seconds. If 30 seconds and you're still feeling fatigued, you can't start the next set. You can bring it up to a whole minute. That is okay. You're still gonna make progress. In conclusion, guys, I don't want anybody to feel demotivated just because he feels he's inexperienced, or he's never been in a gym, or he's overweight, or maybe he has a dwelling injury. That is going to be fine. Understanding, adjusting your intensity, and trying to imply that into your workouts will make your life a lot easier.
Well, that's it for our show today. We hope you enjoyed it. Thanks to our guest, Dr. حنين الرقم, a consultant dermatologist. And thank you for watching. Until we see you again, please stay safe and stay healthy.